Thanks, Tracy. Hello, everybody. Yeah, Doug Boyer from the Texas Commission on Environmental Equality. I appreciate the opportunity just to be here and chat today. I don't have any slides to show. I wanted to talk about a couple of HAQAST success themes that have been sort of going around in my mind. And these themes were already brought up by others talking today. Baron mentioned this too just now. The first one is collaboration. And I think that's best identified with the people in this room coming from such a broad area of our air quality and health communities. And so hearing questions asked today, I think is really great. And in these rooms and outside in the breaks are these best opportunities for us to collaborate and build these bridges. The Tiger teams have been a great resource for state agencies like where I work. They have been so open to questions, attending all of their phone calls or reporting about the different results. In each of those opportunities, they're open to the feedback, they're answering questions, and it's been such an impressive environment. And so I encourage everyone to look up some of those Tiger teams and see what has come from it. Those relationships that are built from that have been some of the most successful avenues for our agency. The second one, the second theme is listening. And it seems like you guys have been really up on your relationship advice and having these listening ears to what people are bringing up. And so in a lot of these meetings, there's been some really interesting questions brought up. And I think that it's not fallen on deaf ears. And so seeing what has been presented already today and then what's going to happen in this afternoon is it's a result of those questions and the needs that different stakeholders and groups have had, and products, tutorials, different things have been developed because of those questions. And so I have been super impressed with everyone's resolve to really work through those. It's been a great honor just to be associated with this program, and I hope to continue that. I'm excited to see what happens with this next, perhaps 3.0 version of HAQAST, and maybe there's going to be an advance to its acronym as well. So thanks for this opportunity.
Thank you, Doug. Our next Flash Talk is Dr. Dan Goldberg. Dan was a graduate student at St. Louis University. Oh, University of Maryland. Sorry. Hi, Maryland. Hi, Maryland. Sorry. I guess in my mind, I think I remember meeting Dan most clearly when we had a meeting in St. Louis many years ago. But Dan has been part of, a great example of someone whose career has been shaped by investments in HAQAST, and now he's part of the superstar team at George Washington University. Here you go.
Thank you very much, Tracy. Let's start off talking about the many successes of satellite data in 3 minutes. So let's go. Here's a global map of NO2 around the world this past year. What's really amazing about this map is you can actually, you can see a lot of different things, but you can also quantify where is the worst NO2 pollution in the world. Some of you have seen this image before, but I'll give you a hint here. It's in this region somewhere. Your first guess might be India, but that would be incorrect. The worst NO2 pollution in the world is actually in Iran, and it's by far the worst NO2 pollution in the world. Not far behind is Baghdad and Moscow, Russia. But it's really quite amazing what we can see from space. We can also track trends over time since sort of the beginning of this HAQAST team, 2019 was our really baseline year, 2019. We can see large decreases in NO2, especially in China, but also in Europe. China, of course, had a very high baseline to start with in 2019. Here in the United States, it's mixed, but mostly down in the major cities. And then also, if you look at the tropics, especially the Middle East and India, we see increases there. Oops, too fast. One project that we've been working on is trying to understand the differences between the column amounts and the surface amounts. That's usually a question that we get from stakeholders. So we have the column measurements from satellite data. How does it look? How does it compare to the surface? On the top row, we have column. Bottom row is our best estimate of surface concentrations using a regression model. And we see pretty good estimates. A spatial correlation between the two, column and surface. However, there are definitely some differences, some very fine spatial gradients that the satellite data is not able to capture by itself, but when you add in some other variables, you get a pretty good estimate. But we now have tempo. That prior work was all using TROPOME, which is great, and it's global, but this is now, if we want high resolution at a local scale, tempo is really the instrument that we should be using here. Here's just our local snapshot of pollution. You can see all the gradients of 2 major cities in the area, as well as the major airports. I don't have time too much to talk about this, but it's a nice animation that we have been working on. But also we've been looking at trying to estimate and correlate tempo with the surface measurements. I talked about TROPOME, now I'm talking about tempo. Just 2 very high-level points here. We're seeing relatively poor correlation between tempo and the surface measurements in the early morning and the late afternoon, but also we have a difference in patterns in that early morning time frame where tempo is suggesting an increasing in NO2, which is probably true in the column, but the surface monitors are suggesting a decrease during those hours. So more work to be done, but after about 11 a.m. it does seem like the trends are pretty similar throughout the day. Last but not least, a project partially funded by the Texas Air Quality Research Program focused on Texas and used the HAQAST data from Laura Judd. We compared that to a source apportionment model, and we're actually able to tease out sector by sector NOx emissions, which really has been the holy grail to try and understand NOx emissions in individual cities. And we were able to find that the on-road emissions needed to be increased, the shipping emissions actually need to be decreased, and the background NO2 also need to be increased. So we're able to tease out individual sectors by themselves. Last but not least, I'm not going to go through this whole thing, but some more resources. Hopefully these slides are available to you, and I'm happy for you to click any of these links. In particular, I made some YouTube tutorials, and we have a lot of the gridded data available. Both the tempo data is gridded on a rectangular grid, as well as the TROPOME on a rectangular grid, and averaged for both U.S. and globally. Thanks.
Thanks so much, Dan, and so many great resources. I think, NO2 has really emerged as such a high-value data product from these satellites, and very much due to your work and others. Our last flash talk is Sheryl Magzamen from Colorado State University. Sheryl's really been engaged in a lot of the work of the HAQAST team, bringing a deep health perspective here. I think I met Sheryl first at an American Thoracic Society meeting a while ago, because NASA has consistently had a strong presence at the American Thoracic Society meetings to directly reach these health communities, and it's really important in doing that to have, knowledgeable health experts who can really build that bridge. So thanks so much, Sheryl. Here you go.
Thanks, Tracy. So I'll be using my very quick 3 minutes to present a case study from New Mexico looking at the Calf Canyon Hermit's Peak Fire in 2022. I just want to thank Chris Wajeo, who led this rapid response team, HAQAST for the funding, as well as the 4 universities that participated in this study and our partners at New Mexico Department of Health. So as Jeff alluded to before, often fires and smoke events happen in under-monitored areas. The Calf Canyon Hermit's Peak Fire happened in the northeast corner of Mexico, downwind from the bulk of the federal monitors that are in the Santa Fe and Albuquerque area, as well as downwind from even where purple air monitors exist. So how do we leverage these satellite data to help us identify smoke and health effects in under-monitored regions of the country? So I wanted to point out for this particular study, we used our classic blended model that Jeff alluded to before, as well as a case crossover epidemiologic approach to understand health effects, both for cardiovascular outcomes as well as respiratory health outcomes, which tend to be our bellwether events during smoke events. So we have here respiratory events, cardiovascular events, and I put boxes around statistically significant outcomes that we looked at. So here we have COPD, chronic obstructive pulmonary disease, look protective, pneumonia, acute bronchitis, but also looking at cardiovascular events, which are less prevalent in health outcome studies looking at smoke. So we had heart failure, ischemic heart disease, as well as stroke. That was using the, our blended model. For this set of estimates, we included some purple air monitors that were in the area. And here we have some different epidemiologic inference based on the type of exposure monitor that we use. So for asthma, which tends to be our bellwether event for smoke events, we see that we have different inference for a lag J5 depending on what exposure assessment tool we use. Here too, we have different inferences for myocardial infarction as well as ischemic heart disease. Okay. So now we're going to add one more monitoring tool, which Kamal Maji from Georgia Tech implemented using a chemical transport model. And here we see that we have incredibly different exposure assessment outcomes as well as epidemiologic outcomes, depending on what exposure assessment tool we use for this particular fire. So what are our takeaways? Well, we usually think of asthma as this, again, bellwether event, but that didn't happen here in New Mexico. Partially, we think because of the demographics of the area. It tends to be an older part of the state with a lot, it's an old mining area. But again, we had this smoke and fire event happen in a sparsely populated as well as a sparsely monitored region of the country. The local purple airs we think may have helped calibrate the results, but again, finding the truth in those three models is quite difficult. And we know that the purple air and any low-cost monitors are not randomly distributed throughout the U.S. In terms of epidemiologic methods, again, we see quite different results when we look at other health effects studies looking at wildfire smoke. So here, trying to use all the tools that we have in our toolbox to understand smoke effects means that we not only need to do ongoing work in terms of blending and calibrating those measures, but understanding the health effects at the ground level also. Thanks so much.
Thank you, Sheryl. So we have a networking break. Jenny, do you want to say a few words? I wasn't sure if you wanted to.
Thank you so much, you all, for being here, and thank you for all the morning speakers and all the future speakers. This is my probably last opportunity to talk to you all, so I really appreciate this opportunity to work with HAQAST over the years.
Thanks, Jenny. Thanks.